Hi, my name is Alok and I am from the globalshapers Bangalore Hub. Today, I will be reading to you a testimonial from a person in Botswana. I remember the first time I met Jane. It was in a public hospital. She was lying in a room that had about 8 female patients. They all looked like they had stepped out of an accident scene. They all wore crispy white bandages or had limbs covered in casts. Their necks were dressed in braces, and one lay suspended in a hospital bed with a back support. I followed the nurse's instructions and counted the third bed from the door. That was Jane's. I introduced myself. Hello, my name is Mona. I am here to help you draft your papers. She looked at me with a swollen face and mumbled a full name, which I wrote down. What happened next was a series of 4 more consultations in a hospital bed, and finally we started meeting at her house after she was discharged about 6 weeks later. Jane was a banker whose husband found it justifiable to beat her with his bat after raping her for continuously until she bled internally. She was my client, a survivor. Jane was one of the many survivors who called me to help her draft the papers for divorce, interdicts and custody of children that would be filed at court. On average, I would get at least 2 calls a week. I would visit at least 4 clients a month in the hospital. Since I started representing survivors of domestic violence in the past 4 years, 3 have died. I lost one to prolonged internal bleeding, another to suicide, the third to an ex-partner who wanted revenge because she left him, and one full custody over her 5-year-old daughter. Post-traumatic stress disorder. I first realized that something was off with me when I had insomnia for a week. As someone who values his sleep, that really bothered me. Insomnia then transitioned to being able to pass out at about midnight, but my sleep was not peaceful. At least 3 out of 7 times a week, I would have vivid nightmares or what looked like recollections of the testimonials of my clients while I slept. Every time I went to the hospital, I would throw up or feel very unwell. I realized that this was post-traumatic stress disorder or PTSD after consulting my doctor. I always thought of PTSD as something that could only be experienced if you directly experienced a traumatic event. My doctor informed me of the following other causes of PTSD. He mentioned that if you witness in person a traumatic event occurring to others, or you learn someone close to you has experienced or was threatened by a traumatic event, or you repeatedly are exposed to graphic details of traumatic events, which I was, you could end up with post-traumatic stress disorder. How I managed PTSD. Quitting my job or choosing to handle other matters would be the first way to curb PTSD. However, I love my job and it fulfills me. I do not like the idea of using medication unless I absolutely have to. So instead, after consulting a therapist and doing my own research, I discovered that I am able to function better and put an end to insomnia by dedicating a lot of my free time to staying connected to people outside my network. This includes family, friends, and taking on volunteer initiatives. I have not been able to fully get rid of nightmares, but I have managed to get myself to wake up from them and reduce the number of bad dreams significantly. I have done this by focusing on hobbies, trying to live a healthy lifestyle, and taking time off from work to do other things that I love. This is a message by Global Shapers, Bangalore community and other hubs that are taking part in this initiative to bring about a kind of awareness about mental health. Thank you.